Welcome to the TFT Performance Podcast. I'm your host, Jordan Solomon. This is the show where we break down popular science into easily digestible and actionable information to give you the blueprint to be a high performer in your life. Today, I'm joined by TFT Performance Dietitian Ryan Hasell, and we're talking about the science of obesity and discussing the question, when does being overweight become a clinical problem? In this episode, we'll break down the truth about assessing obesity, discuss what metrics are most useful to use, whether or not all fat is created equal, what the associated risk of having excess body fat are, and we finish with a discussion about weight stigma and negative health consequences associated with it. Let's get to it. All right, welcome to another episode of the TFT Performance Podcast, joined by the dojo himself, Mr. Ryan Hasell. Doge, thanks for coming on.
Hey, Jordy, thanks for having me.
Really good episode today, really massive episode that we're going to be very careful about how we unpack it, because it is a really important issue that I think everyone that's in our community and our listenership should be aware of. And what we're going to be talking about today is the conditions of overweight and obesity. And I know that in our community, it can be, especially in the dietetics world, it can, if we're being very blunt, there's been a whole movement where we move away from not diagnosing overweight and obesity, but calling what overweight and obesity is. And, there's a lot of movement to say, we don't want to stigmatize these people, which is absolutely warranted. However, we do need to appreciate that overweight and obesity is a condition. There are health implications associated. However, I also think on the other side of that coin, it's a very misunderstood condition. There's a lot of nuance to this that a lot of people, at least at surface level, do not understand. And I think we have this clashing of these two sides, especially when we say people say, you can be overweight but still healthy. And then people on the other side saying, no, absolutely not. The second your BMI gets over this number, you're going to be doomed forever. That's absolutely not the case. There's a lot of gray area in between. And what we want to do today, Dojo is going to break down a lot of that science. What we're going to do is break down a lot of that science. So when it comes to this topic, you guys can make a bit more of an educated decision about it when we're having these discussions.
Yeah, I think that's exactly right. It's definitely something I noticed, obviously just graduating recently from nutrition and dietetics within like the university scene. It's something that's kind of like coming through a lot more in the teaching, is like going away from talking about things like obesity and being overweight, because I think there are all of these like negative like sort of stigmas or associations around it. But like you said, I think it's still important to talk about, because I think if we just kind of like throw it out completely, we kind of miss a lot of what's actually going on here. So I think it's important to understand like physiologically, like what's going on in the body in these sort of situations, and then take a look at it from like a practical point of view about, okay, how do we actually deal with this, rather than just like labeling people as being overweight or obese and potentially causing other problems through doing that. So I guess like an important part to probably start, important way to start here is kind of like defining what is obesity, what is being overweight, like what does all of this mean? How do we actually tell if someone's obese, and like what does that mean? So like a standard definition, there's like a World Health Organization definition that's pretty widely used, where someone with a body mass index or BMI over 25 is considered to be overweight. And that's just a ratio basically of how tall you are versus like how wide you are. So well, like actually like how tall you are versus how heavy you are. But it's just a ratio of like comparing your size to your weight. And then if your BMI is over 30, that's when we would consider you to be like obese via the definition. Couple of quick facts, like this is definitely something that is increasing. There's obviously people push back against this, but this is something that's even in children around the world increasing from like 4% up to like nearly 20% of the population of kids all around the world are getting overweight and obese, even in countries that previously would have been like really impoverished. Obesity is definitely on the rise. So that's kind of like what obesity is in a nutshell. It's a bit of a growing problem. But let's talk about why obesity is a problem first, I think, Jordy. And like the actual, I guess, like the actual practical implications of that. So I guess to start off with, maybe we'll kind of run through some of the common risks associated with being obese. So do you want to come run through those, Geordie?
Yeah, I think it's a good point as well. And just before we get into all of that, again, I want to make this very clear because I know people are going to be listening to this and they might jump up. What we're going to do is we want to define, when does this actually become a problem? Because we want to go through this physiologically, because that does happen. There is instances, and we know, like Dojo said, when people see a certain number on the scale or their body composition changes, and we'll talk about probably something that's more important is where that body composition changes around your body, there will become problems. And that's what we want to go through. We want to go through, what are these changes that happen in the body when someone is experiencing obesity? And when is it at that point, when do those things become very problematic to your health? So Dojo, let's go through it. Let's start through. There's a whole lot. And I want to preface this, if you guys are listening to this, we're going to go through this in depth. So if you want to 1.5 times the speed to get through this a bit faster, highly encourage you. But we're going to break it down. Dojo, let's just run through it. I'll throw it back to you. Let's start with cardiovascular risk factors, because I think that is by far one of the biggest things that people need to be aware of when we're talking about obesity.
Absolutely. So with cardiovascular, obviously, like this just means like the heart system in the body. So like your heart, your blood vessels, all of that, the way your body distributes your blood and gets oxygen around. So some of the problems here that are associated with obesity are things like dyslipidemia. So this just means like the levels of fat in your blood can kind of go out of whack. There's a risk of developing type 2 diabetes, hypertension, which is just meaning your blood pressure can become increased to a point where it's too high, and then also leading to things like sleep disorders down the road, which we'll kind of unpack a little bit as well. But these are kind of like the main cardiovascular risk factors that we see associated with being overweight and obese. And these things in and of themselves, in particular, like they're not going to like kill you, but they will potentially lead to the risk of developing things like heart attacks, like artery plaque, things like that down the road, which then can lead to like poor health outcomes, and even like death. So these are the risk factors associated with being obese. But one thing that I found when I was kind of like digging through the research here is that they're definitely associated and with being obese and more common in populations of people that are obese. But there's one thing to really kind of like separate out here, and you kind of talked about it just before, Geordie, and that is that it's kind of more important about where that fat is actually stored in the body as to how much impact that's going to have on these risk factors. So a really important like distinction here is between the like subcutaneous fat, which is the fat that we see more visibly. This is a fat that like subcutaneous just means under the skin. So this is all of the fat that kind of just like exists on your body that you can kind of grab onto and feel. That's just subcutaneous fat. That fat is not considered to be as dangerous as what we would call visceral fat. So visceral fat is a little bit harder to see. Visceral just means it's around like the main like organs of your body. So if we think about like from our hips up to like our shoulders, most of our organs are contained in our abdomen. So having a lot of fat distribution in this area is where we start to see problems. And this is something that can kind of be, you can test a little bit. There's things like if you notice you have quite like like if you're overweight but you have quite like a firm belly, that's sometimes an indicator of a higher visceral fat content. But there is actual ways of measuring visceral fat as well. And someone who is sort of classed as having a lot of this visceral fat is more what we would call abdominal obesity, which would be separate to overall obesity, which is like where you have basically a lot of fat everywhere. And there's actually a big difference between the two in terms of these risk factors. So someone can be like what we would call overall obese, have a lot of subcutaneous fat, and actually not have a lot of these risk factors. They might test their bloods and everything comes back normal, versus someone who may not present as looking very overweight, but they have a lot of visceral fat. And if you checked their, you like did these tests on them, they would come back as abdominally obese. They would be a lot higher risk of a lot of these health conditions. So the tests for abdominal obesity, there's a lot out there. A lot of the common ones are around like just testing circumference of your waist. So in men, we would classify anything over 102 centimeters around the waist as being abdominally obese, and then anything above 88 centimeters in women. Something that's probably a bit more of an accurate measure, though, is what we would call like a waist-hip ratio, because some people are just like larger humans, so their circumferences are going to be bigger just through combination of a lot of other things, including the fat. So by testing the ratio of their waist circumference to their hip circumference, we can get more of an accurate picture of, okay, where is this fat being stored? And is it actually a result of fat, or is there other things involved, like maybe just big skeleton structures, a lot of muscle mass, that kind of stuff? So a waist hip ratio for men of over 0.9 is considered to be abdominally obese, and then over 0.85 for women. Now, in particular, this abdominal obesity is strongly linked to things like atherosclerotic cardiovascular disease, that's just plaque forming in your arteries, heart failure, arrhythmias, so that's like irregular beats in your heart. All of that, like cardiovascular dysfunction stuff, seems to be really strongly related to having fat around that abdominal region.
Yeah, I think this is the first point that we need to highlight here when we're talking about, okay, overweight and obesity, when does it become a problem? This is the first major point that we need to make, in that there is an argument to be made for, okay, someone can present as not so overweight or not so obese and still see these problems. I think we all know that person in our lives, or we all have that friend who we would describe as, for lack of a better term, skinny fat. Skinny fat. We know that person who's quite got a slim body, but they probably live not the healthiest lifestyle. This is the type of person that we would describe as what Dojo is talking about, as having, not presenting necessarily with a BMI that would cause them as being overweight or obese. But then if you dug deeper and you looked at their bloods and you even got them to do some tests to look at their visceral fat, that would class them as a risk factor of all of this. They would have that central adiposity or that central obesity that would cause them to have higher risk factors for all of these things. So this is something that's important that people need to think about more, because whenever we think about, oh, okay, overweight and obesity and all these risk factors and blah, blah, we typically think of a larger person. And as Dojo said, it is very possible that we have people for BMIs that are higher than 25 or 30 that may not present that central adiposity and have this visceral fat. And again, if we're thinking about people we probably know in our lives, I think I grew up playing rugby. We all know that rugby player who's a tight head prop or a loose head prop, really nugget type body, really, when I say nugget, if you guys don't understand that term, really short, broad shoulders, quite muscular. They're in a bigger body, but they're not necessarily fat or not necessarily overweight or obese. That's just, and then you look at their parents, or you look at their dad and their grandpa. I played rugby with so many tight head props and things like that. You look at their whole family, they all have that same build. They're not necessarily overweight, obese. These are guys that are training 5 to 7 times a day. They eat really well. They're probably not going to present with that central adiposity despite their BMI being heavier. So this is really that first nuance when we look at that and we think, okay, when does it become a problem? Okay, there's probably a bit more to look into rather than just what you see when you look at it with your eyes.
Yeah, I think another really interesting example that I found for that is like sumo wrestlers. So obviously when you think of sumo wrestlers, right, you think of these huge people, a lot of fat, but a lot of these guys in sumo wrestling are actually like extremely fit. Like they train for hours a day. They just eat so much food, but because they're exercising and they're eating like healthy food, a lot of that weight gain seems to be like subcutaneous and stuff. And they actually present as like pretty healthy people, even though they're so like excessively big. Like you said, it's more to do with, I think, like lifestyle stuff, which we'll kind of dig into around like why that fat gets deposited in certain places, rather than just the existence of that fat. So I just want to go over a couple more things here in terms of like risks associated with that abdominal obesity or obesity. And that the next one, which I think it's still kind of related, but it's outside of the cardiovascular system, is more like metabolic dysfunction. So one of the most common things that will happen, as well as the cardiovascular stuff, and they're really closely linked, is something called, it's got a couple of different names, but one of the main ones that get thrown around is non-alcoholic fatty liver disease. Bit of a mouthful, but basically all that means is just fat accumulation on the liver, but not caused by like alcoholism and stuff. So obviously people that have alcohol abuse, they will develop similar problems, but this is independent of that. So someone who doesn't have alcohol abuse issues, but they still have fat deposits on their liver, they're excessive and shouldn't be there. So one thing that having this excess fat around the liver does is it increases a bunch of metabolic activity that wouldn't normally exist. So we see things like increased inflammation markers, like systemically around the body, as well as increased things like blood glucose levels and blood lipids or blood fat levels, as we talked about before. So a couple of problems here, which if you've listened to some of our podcasts about carbohydrates and things like that before, you'd know that if you have these chronically elevated levels or chronically like high levels of blood sugar, one of the things that happens as our body tries to compensate that is we'll also elevate our insulin levels to try and pack away that sugar or that blood glucose into our muscles and get it out of the bloodstream, because we don't want a high level of sugar circulating around in the blood for too long. The problem with that is if we're compensating for that over a long period of time, our body gets more resistant, less sensitive to that insulin, which then, if you understand how insulin and the body works, is a huge risk factor for developing diabetes. So over time, what will happen is we'll get less efficient at packing away that blood sugar to the point where we potentially become pre-diabetic as a result of this non-alcoholic fatty liver disease. And then one of the downstream effects of that can be developing something called type 2 diabetes, which is then irreversible. So you've got, like impaired blood glucose control, impaired blood fat control, as well as, so those are like kind of like directly linked to this, but this non-alcoholic fatty liver disease is also independently linked to all of those cardiovascular problems that we talked about just before as well. So like you can imagine having both of them together. If you've already got these cardiovascular risk problems and then you get the liver stuff on top of that, it all kind of just compounds and becomes this big like systemic problem. Now with non-alcoholic fatty liver disease specifically, it's something that's almost completely reversible. There's different stages. Once you get to the last stage, which is like liver fibrosis, there's like scarring of the liver tissue that is like impossible to reverse. But in the early stages where there's just like increased fat like deposited on the liver, there's maybe like systemic inflammation, that stuff can be reduced and sort of reversed. And the best way of doing that through lifestyle management is, and has been shown like pretty consistently, is weight loss. So there was one study that showed weight loss of like 4 to 10% is like the recommended amount, but anything from 10 to 40%. So this is obviously in individuals where that sort of weight loss is like realistic, that can almost reverse all of these negative health effects in people that are able to actually get there. Now, obviously, like a 40% reduction in weight is a huge thing, and that's probably not realistic for most people. That's why they go for the lower recommendations of like 4 to 10%. But it just shows like that sort of weight loss can almost like completely reverse these negative health outcomes. Another couple of things though is that diet, like certain types of diets, in particular, they looked at like the Mediterranean. I'm sure there's other like healthy diets that could work here as well. But just having a healthy diet, independent of losing that weight. So even if the study participants ate healthy food, but they didn't lose weight, they were still able to reduce some of the negative effects of non-alcoholic fatty liver disease. And then exercise on top of that was also helpful in reducing the actual fat on the liver. Not necessarily clear whether it would reverse or like have the same effects as healthy diet. So all of the recommendations that get thrown around for this always include, they always say healthy diet and exercise together. If you do one or the other, like it's going to be kind of helpful, but the gold standard is kind of doing both at the same time. And then like through doing that, a lot of the time, the outcome that's just kind of like passive from that is that you will lose weight. But it's a good argument for, I guess, just managing this stuff through a healthy lifestyle change rather than having to focus on the weight loss. Because while the weight loss will definitely drive these improvements in these health risk factors, just by making these small dietary or lifestyle changes, we can actually help a lot of these conditions.
Yeah, and hopefully people listening to this, it's starting to make a bit more sense of why this is not a completely black and white argument. And because we're very much going into the gray area here, because like Dojo just said, it's not necessarily clear cut. Is it diet? Is it exercise? And if you do one or the other, and NAFLD, which is now called MAFLD, metabolic associated fatty liver disease for the nerds at home, this is something that pretty much got me into dietetics. I had a very close family member who was experiencing, we call it NAFLD back in the day. And I helped her treat it using dietary approaches, worked with the doctor alongside. And again, it is something that works. If you have people who present with NAFLD, making specific dietary changes will see a reverse in that if they stick to it. So there can be positive health outcomes by changing that. And that can happen, like Dojo said, independent of exercise. And in some cases, it can happen independent of weight loss. But what you need to understand is that this is a far more complex issue than when we look at people and say, hey, you just have to lose weight. Just lose weight and you'll be good. And it's like, no, well, there's a lot of nuance to that. Like we said before, and we'll keep talking about, not all obesity is the same. Essential obesity is very different to just general obesity. Yes, there's risk factors that you need to be aware of, and you need to be very cognitive of what's going on with that person, but digging deeper and treating that individual is going to get you far better results than just saying to them, hey, look, you just need to exercise and lose some weight.
Yeah, I think that honestly could be like a really important takeaway from this. And I think a lot of these like blanket statements around like just lose weight or just do this, like that get thrown around because they show evidence at like a population level are not always like specific enough to the individual. And I think that's where more like individualized treatment is so much more important. Like not just treatment, but like in terms of like sport and lifestyle management. I think going for an approach that's like tailored to the individual is super, super important for like actually seeing meaningful outcomes for these things. One last sort of health condition risk factor associated with obesity that I just want to kind of gloss over as well before we kind of chat about the more of like the concepts around how we talk about and look at obesity is obstructive sleep apnea. So this one isn't one that's really thrown into the picture that much that I hear about. Like when people talk about obesity or being overweight and the risks associated, it's normally, okay, you're going to have like metabolic dysfunction, you're potentially going to become diabetic, or you're going to have these like heart issues. But something that kind of goes a little bit under the radar, but is starting to get a bit more traction now is this obstructive sleep apnea. So one thing we know for sure is that disturbances in sleep have a huge impact on obesity and our body's ability to regulate its metabolic functions. Like sleep is this really, really important thing that our body uses in order to like reset all of its metabolic processes that it's been running throughout the day. It's really important for recovery. It's really important for regenerating neurotransmitters in the brain. It's really important for a huge amount of metabolic processes in the body. And through impairing our sleep or having decreased like quality sleep, we have a risk of, or it has an impact on our metabolism, which can lead to things like obesity and becoming overweight, even independent of like healthy lifestyle. So sleep is this really important thing in terms of managing a lot of these conditions as well. But the kind of double-edged sword here, or like the way that it kind of becomes like a cycle is by being overweight and obese. For some people, this can actually lead to obstructive sleep apnea through increased fat deposit in certain areas on the neck, which can actually obstruct airflow while you're sleeping. So you kind of get this negative feedback loop of once you get to a certain point of being overweight or obese, that starts to impact your sleep, which then starts to make it harder to lose that weight in the first place. So it's kind of this negative cycle. aside from it being implicated in weight loss and obesity and stuff, having poor sleep quality is also like independently shown to impact all of these things as well. So like whether you're obese or not, having really poor sleep quality is going to put you at risk of developing type 2 diabetes, cardiovascular risk. All of these things that we've just talked about as being risks of like associated with being obese are also risks associated with just having poor sleep quality. So it's something that's really, really important. And over time, like if you're having this over years and years and years of these we call them like, I think they're called like hypoxic events or whatever, basically just like when you stop breathing because your airway is obstructed, you get this drop in blood oxygen saturation, which basically is going to dysregulate your cardiovascular system over time. There's like a lot of dysfunction and stuff that can happen there. You're going to get alterations in cardiovascular function. One of the really, I don't know about common, but like one of the main clinical presentations of this over like a long time is something called, what is it? It's like basically like left side heart failure, like pulmonary hypertension, sorry. So this is where the like, you basically get hypertension around the cardiovascular system, in terms of like between the heart and the lungs. So you can also get interrupted sleep from that as well as like difficulty with breathing. It's a really serious condition. Now, sleep apnea and obstructive sleep apnea in particular related to obesity, one thing that's been shown as like a really effective treatment for this, even for people with like moderate to severe obstructive sleep apnea, is a 5% decrease in weight. So that's like a pretty small amount of weight loss compared to what we just talked about for the liver stuff. But even such a small decrease in weight for some people, not all, like because obstructive sleep apnea can happen outside of obesity as well. But in the people that are having this obstructive sleep apnea as a result of obesity, a 5% decrease in weight loss can be just as effective as those CPAP machines that you see where they have like assisted breathing. That small amount of weight loss can be just as effective. So I think it's just really kind of important to see like these health risks that we've just talked about, the cardiovascular disease risks, the metabolic dysregulation risks, and the effect on like sleep and sleep dysfunction. All of these are very real things that are like the science is definitely there to support that they are like your risk of having any of these is increased through obesity, and especially abdominal obesity. Obviously with the sleep stuff, that's probably more to do with like general obesity, but in like an overall sense, there is definitely still like we still need to discuss the fact that obesity puts us at risk of these health conditions.
That's such a good point though, Joe, because sleep apnea for me, and I think sleep apnea is something I talk about a lot because we associate ourselves so closely with sleep experts because it's such a huge important factor for performance. People like Dr. Ian Dunnican and me and him talk extensively about sleep apnea. And we're given a very broad. Sleep apnea is a very complicated disease. There's all different sub-series of different types of sleep apnea. What's important to recognize here, and again, it goes to the point of you have to treat the individual. Obesity is absolutely a risk factor for sleep apnea. And like we spoke about, even when we look at that individual, where that fat is placed over their body, if you see this in clinical practice, you see people who are overweight or obese, and you see that fat that's deposited around the neck and it physically blocks the airways. I don't know if you haven't seen or experienced that, and we have someone that we go on tour with who unfortunately is experiencing this. You hear them sleep, it sounds dangerous. Like if you've never heard someone go through sleep apnea or obstructive sleep disorders, it sounds dangerous. And you can hear those points throughout the night where they trip up and they go hypoxic because they trip up on their own breath and they choke. And it's quite terrifying. And once you see that in person and you see that in practice, you realize, oh my God, this is a serious condition. There is very, very good evidence to suggest that weight loss for those type of people will improve that sleep apnea, and that sleep apnea, as Dojo has outlined, can have very negative effects on so many other factors. and it's very important to treat. And then it plays into this whole condition, this whole metabolic condition that links back to cardiovascular disease, to metabolic dysfunction. So it's almost this cycle. But on saying that, again, if we come back, well, this is a big gray area. I've seen many people as well who present with sleep apnea who aren't overweight or obese. And there could be other things going on, such as something as simple as their nasal cavity or their nasal canal is too thin and they can't nose breathe. And then they have to breathe through their mouth, and they can even be thin, and they can have weak muscles or for whatever reason, and that's causing sleep apnea, and they're experiencing the negative consequences of sleep apnea independent of their weight. So this is where it comes, okay, we need to look at this at the individual level and explore this gray area, because hopefully now that we've gone through all of this, you realize that it's basically all gray area. And it's very rare that you will see people that come in clear cut, okay, you're obese and you have all of this and blah, blah, you just simply lose weight and then we're good. There's usually so much more that you have to address. And I think before we get into the language that we go around, I think it's an important note, because we keep referring back to this, and I'll use the analogy that I use with, say, if you're a rugby head talking about a tight head prop who has that body, or like Dojo said, a sumo wrestler with this distribution of fat throughout their body, the adiposity where it is, and this central adiposity being a big risk factor. It's important to note, and we see this a lot with combat sports athletes who retire. So athletes who are in that position, say sumo wrestlers training 5-6 hours a day, eating a lot of calories, they've got the subcutaneous fat, they may not have the central adiposity, but say what happens when they retire? What happens when they retire? This is where all of these things become a problem, right? We see this so much with retired athletes, is they take this active lifestyle, which contributes in a positive way to all of these factors that we're talking about, all these risk factors, and they take that out. And then all of a sudden, they're used to eating all of these calories. They've got this extra subcutaneous fat. And then all of a sudden, what used to be positive or not entirely negative to their health becomes negative, because they've taken away that healthy lifestyle. So hopefully, and the reason I bring that up is because it is a complex issue that is a combination of, yes, your diet, yes, your exercise, and your lifestyle factors that all feed into this. And we're saying, yes, there are these people that can present as overweight and obese, may not have the central adiposity, but that can change. That can absolutely change. Say if they have lifestyle changes, then all of a sudden they move into this category of, yes, this is a real risk factor for your health. So, and the reason I'm saying this, and if you're saying, oh, you've already said that 3 times, the reason I'm bringing this up is to highlight just how much gray area there is in this. And it's not as clear cut as, hey, you're overweight, you need to do this. You're underweight, you don't need to do this.
Yeah. I think it's super, super important to make that distinction, because I feel like a lot of the problems here come with lumping people into groups and then being like, this is what works for you because you're in this overweight or obese group. Whereas we really need to start looking at what is the best for this individual. And like, so one thing I want to kind of go over here is like a downstream effect of that, like lumping people in as being like overweight or obese, and kind of like the negative sides of that. So when we start just like labeling people, and like obviously it can become used like outside of a clinical setting as well, like the negative effects of just like being overweight in a society that kind of like leads to judgment of that, like, so because it's not really associated as being like a favorable thing. Some of the downstream effects of just like the negative association around like maybe like the verbal abuse or judgment or like societal pressures that come along with that have been shown like in the science to be almost just as, or if not the same amount of a risk factor as the actual physiological obesity effects themselves. So like that negative stigma and all of the sort of like the guilt and I guess like social I guess like just stigmatization is probably the word for it, can be just as harmful for these people as the actual obesity itself. So I think like this is a really good argument for like why it's bad to just lump everyone into this group, because now that we kind of understand like not everyone that is going to be looking overweight or obese is unhealthy, I don't think we should be just like judging that on like face value, because some of the negative things that can come along with that are almost just as negative or just as impactful on these people's health as the physiological effects as well. So some of the things that are shown up in the studies of just through association with like negative weight stigma on physical and mental health are things like diabetes risk, cortisol levels, so that's to do with elevated stress levels, as well as other stress markers, things like CRP, C-reactive protein. And then a lot of the stuff that comes along with this is then also going to be like mental sort of dysfunctional or mental health issues. So things like depression, anxiety, body image issues, things like dysmorphia, which these things can become like really, really serious. And in some cases, more of a negative health implication than just being overweight and the health implications involved with, like, as we were talking about before, like abdominal obesity. So I think that kind of like highlights the importance of removing that judgment of like, okay, this person's overweight or obese, they're unhealthy, and rather thinking about it as like, okay, what is this person's actual situation? Like, what's what they really need to do in order to like are they even unhealthy? Like, there's so much to be considered there. And so I feel like it's more of like a communication thing or like an idea thing that we kind of need to remove that stigma away from just being overweight is bad or just being like obese is bad, because it's not always the case. And that is something that, as we talked about at the start of the podcast, is something that's starting to come through in terms of like the teaching in universities and that kind of stuff. It's definitely being pushed a lot, which is good, because like as we've just said, like by removing a lot of that stigma, there's probably a reduction in a lot of these negative health implications. But it's still like we still need to be aware of the risk factors that are involved in the particular cases, things like abdominal obesity and stuff, where there are like physiological issues going on. Another thing that is kind of important to touch on here as well, that can come as a result of a combination of things, but in particular, especially things like the mental health side of it here, is where we get into what we would call like yo-yo dieting or chronic dieting. So do you want to kind of just like I guess this is something that is like we're probably in a good position to talk about. Do you want to kind of go over what is chronic dieting or yo-yo dieting and what your experience has been with that, Geordie?
Yeah, we see this all the time in combat sports, right? And really, what we're saying, if you think of a yo-yo, what to do, goes up and goes down. That's what we're talking about when we talk about yo-yo dieting here. We don't just see it in sporting context. You see it just as everyday people who have a tendency to go through these dieting phases where they chronically diet and they go on chronic low calorie diets and they drop their weight down, but then they have this rebound period where they rebound and they go back up. And what we see often, both in sports and just in everyday people, is when we see that rebound, they often rebound to a place that was worse than when they started. And this is kind of sets off this perpetual motion of why they always have to do these 8-week challenges or why they always have to be doing these new diet trends. And it's kind of the foundation of the whole statement of diets don't work, which is a whole entire podcast in itself. And I don't know how much I agree with that statement, but that's where that comes from, is this yo-yo cyclic type of nature where people go down and then they go back up. And it's a really, really interesting when we talk about this. But one thing I do want to say, just before we leave the weight stigma part, and I'm going back and forth here, I think it's really important that we are talking about this. Like Dojo said, there are these absolute risk factors when we're talking about this. One thing I've noticed when talking to, say, doctors who don't receive a lot of, say, nutrition training or talk about this is something that I hear a lot from patients and clients, is that when they walk into a doctor's room, they're immediately judged on their body size. And regardless of what condition they're presenting to the doctor will automatically assume, hey, you need to lose weight and that'll fix it, because they've been ingrained to think, okay, whatever this issue is, you look like you're overweight or obese, you need to lose weight and then that'll fix it. And like Dojo said, this just plays into this whole mental health cycle where that's going to be negative on the mental health side. And we could do a whole nother podcast just on that. But like I said, and we've been saying, there's a whole gray area here where that doctor has not explored, where losing weight may not even be appropriate for that person. It may not fix the condition they're in for. They've just made this assumption based on how they look. So I think that's a very important thing. And like Dojo said, it's important that this is being taught more in universities because we need health professionals to recognize this. You need to recognize this and you need to treat that individual for when they come in. I know that there's health professionals out there now that advocate you do not even have that discussion about weight until they bring it up, or you've done the adequate investigation where you know that is going to be beneficial for their health when they do lose weight. And I think really at the root cause of the problem, when this goes, I'm going deep here, but it goes systematically, like how much can you do in a 15-minute consult with your GP, right? So, but that is really an important thing. But back to yo-yo dieting, again, cyclic in nature, goes up and down. That can be hugely, hugely detrimental both to mental and physical health. But I'll let you wrap that up there, Dojo.
Yeah, for sure. So it's definitely something that is well established. There's studies that have gone looking at contestants coming out of Biggest Loser, and like there's a lot of really iconic things where you get these people that restrict their intake and they probably compensate with a lot of exercise as well. Initially, they see like big decreases in weight, which is often like a positive thing. But then over time, because the diets or the exercise programs or the lifestyle changes that they're making like unsustainable, or maybe they go back to an environment that it's difficult to kind of like continue on with the same sort of process. What happens is over time they just slip back into old habits, same eating patterns, like losing the exercise routines, and the weight starts to come back up. And as you said, as a result, oftentimes the weight will basically all be regained, and then oftentimes even rebound a little bit higher than where they started with. So like obviously you can imagine how defeated you would feel if you've just done a huge like like maybe like a 12-week weight loss challenge or something, or like, and your weight's gone down, and then all of a sudden at the end you're like, oh yeah, I'm so relieved, and you have like a big celebration meal and then like a couple of weeks off to celebrate, and then you check the scales and you've just put on everything that you've worked so hard to lose, and like maybe even more. And one of the cases where this can become especially a big problem is when that weight loss is done for sort of more like body image, like with like more like body image intentions, and we get these sort of like negative feedback loops around more like dysmorphic thoughts of like, oh, like my body's not good enough when you're a certain size and you're trying to like aim to get your body to be somewhere. And I think like the negative health ramifications of that are actually quite severe, and that's where we start to dip our toes into the territory of like disordered eating and eating disorder patterns, things like anorexia, bulimia, binge eating, these sort of really, really serious eating disorders that can stem from like a long period of doing this yo-yo dieting where you're just trying to like lose weight and then you kind of fall off the bandwagon and then you get back on and you fall off. There's a lot of evidence to support that that's a thing, like this yo-yo dieting. What is not so much supported by the evidence at the moment is there is some evidence to say that this yo-yo dieting can also have some negative effects on our metabolic health, our cardiovascular health. The same sort of stuff that we see in that abdominal obesity has been shown in some studies with yo-yo dieting and chronic dieting. It's not as strong, but it is like still a good like argument for why it's not the best idea to do like, like a patty pimlet and just shoot up and then go down and then shoot up and go down. And a more like sustainable lifestyle adjustment is probably going to be way more effective than doing these really extreme diets down and then having to compensate and like blow out and like have the weight rebound and then try and cut down again. Just doing something really slow and steady over time with sustainable dietary changes and exercise stuff that we enjoy and can do over time, regardless of the effect on like our appearance or our weight. It's going to be way more effective in the long term in driving like positive changes than doing these extreme like crash course diets and crash course exercise programs for addressing these problems that we've talked about that are related to this abdominal obesity and stuff that we've chatted about.
Yeah, I think we'll pretty much wrap this up here. And I think because that's a lot of information, right? That's a lot of information to go through and to digest. If we're recapping, I think the biggest point that we need to go over here is that it's not black and white. When we talk about overweight and obesity, it is not black and white. There's a lot of gray area. You really do have to treat the individual. What I need to be careful with saying here is that I'm not at all advocating for people to be overweight or obese. I'm not sitting here saying, hey, you can go out and just smash as much cheesecake as you want, have a very inactive lifestyle, do nothing, smoke heaps of cigarettes, drink heaps of beers, do whatever, and then get in that state. But there is more to the story. And I think when people pass judgments, snap judgments on people, when they just look at them and go, oh, that person's overweight, that person's obese, they need to lose weight, they're lazy, they're whatever. That's not the case. That's not always the case. Some people, absolutely, there's going to be lifestyle factors that, maybe they just eat and drink and do all these other things, and that's contributing to that, and that's going to have a negative aspect or a negative effect on their health. But that's not everyone. And that's really, really important. You need to be aware of that. And this topic is still debated, right? Like Dojo said, we still don't know. It's not a clear-cut answer in the evidence. How much does this really play into that? How much does being overweight play into this lifestyle factor? How much does being overweight play into this? There's absolutely times when you get clients coming in where you do a thorough assessment. You look at all their blood, you look at their metabolic data, you look at their visceral fat. There are absolutely times where you need to sit down with them and you need to say, losing weight is going to be beneficial for your health in the long term. It's also going to be beneficial for correcting all of these other things. If you've got a condition such as sleep apnea, it's very, very likely that you losing weight will help improve that. But there's also going to be times when you get patients in and clients in and you look at them and you run all these tests and you go, you know what, maybe there are other factors we need to look at that don't have to do with losing weight that'll make you more healthier. And that's something that for a lot of, say, old school practitioners or old school clinicians, or even people who aren't so educated in the area, it's hard for them to hear because we have been drilled into our head that if someone is overweight or obese, that means they're unhealthy. And we're not at all defending and saying that can't be the case, because it absolutely can. It's just that it's not always the case.
Yeah, totally agree.
Yeah, I think let's wrap that up here. And I think we'll do another episode to explore this a bit more. And we might even go more on the practical side of it. It's a lot. It's a lot to digest. And it's really a big paradigm shift for a lot of people. For a lot of people, I find, at least when I talk to, say, younger practitioners about this, it can be really difficult for them to grasp this concept. And there's almost resistance to it because it goes against a lot of the teaching, especially if you haven't gone through the education system. Say if you, so like me or Jack, or we went through education system a while ago, it wasn't necessarily taught when we were going through university. Thankfully, now we're kind of seeing a change as the evidence is changing, as the times are changing, people are talking about this more. But again, I'll say it's not always black and white. You need to treat the individual that's sitting in front of you. And for anyone listening here, one thing that I'm very passionate about, do not pass a snap judgment on someone when you see them and say, hey, they're overweight, they're obese, they need to lose weight to be healthier. That's not always the case. All right, Dojo, thanks for coming on. We'll wrap it up there.
Easy. Cheers, Jordy.
And there it is, another episode of the TFD Performance Podcast. If you like this episode and you enjoy our content, then you will absolutely love our new TFD Performance Hub. Our first course on the hub is the Performance Nutrition for BJJ course, which is perfect for grapplers looking to master their nutrition. And if you follow the link in the description, you can even snag 40% off that course. This podcast will be available through the podcast app, iTunes, Spotify, YouTube, and if you follow along our socials at @the_fight dietitian, you can see all of the best bits from our podcast episodes. Thanks for listening in, and I'll see you guys for the next episode of the TFD Performance Podcast.